There's nothing like being an infectious disease doctor during a pandemic. It's just been a very difficult experience, but I think it does help you understand sort of the priorities of life and also the areas where healthcare needs some improvement.
I think people have forgotten the horror of what COVID was like at the beginning. At the point that I came on, to be the ID doctor rotating in the hospital, we had 2 confirmed cases admitted at that point. By the end of the week I spent on, we had over 100 confirmed cases admitted. We didn't know if we were going to get it, and we didn't know how sick we would get. I know several doctors who got very sick from it, almost died. Nurses who got incredibly sick. It was just tragic.
Those first few months and that first week were particularly surreal. Our first patient was a 35-year-old man. He went straight to our intensive care unit. And I remember my friend, Dr. Chandrasoma, the pulmonologist, as he was beginning to get more and more short of breath, and he was clearly going to have to be put on a ventilator, putting on her PAPR, calmly went in and stroked his head, and then they sedated him and they intubated him. And he died 24 hours later. We understand death. We understand that, we can't save every patient, but when you're having 100% mortality with your first experience with this thing, it was pretty overwhelming. We've made enormous advances during this pandemic that I think are a direct result of the fact that we had to deal with this in real time.
We've learned how it spreads. We've learned that masks help prevent it. We know the vaccine works. Science is a process, right? We don't get an instant answer. People have to understand that we are doing our best to help, and we are doing our best to do what's right for everybody. And that if something like this happens again, whether it's bird flu or the next coronavirus, that when the time comes, people will do what's needed to get it under control, save lives, protect people.